Morning and welcome to the media briefing with the Windsor-Essex County Health Unit for Thursday, March the 24th. We are joined today by our CEO, Nicole Dupuis, our acting MOH, Dr. Shankar Nesathuri, as well as our manager of the Epidemiology Department, Ramsey D'Souza. We will start today with our epidemiology summary, and then we'll move into some opening remarks from Dr. Nesathuri. Thank you very much, Ramsey. You can get started.
Thank you, Ashley. Good morning, everyone. So for this week's epidemiological summary, I will quickly go over what we've observed as well for this past week, highlighting some key trends that we've seen and what the overall takeaway is. So let's begin. So when we're looking at our weekly case rates for this week, we've seen about a 14% increase compared to where we were last week. Once again, these include only our high-risk case rates since the testing changes in December 31st. When we compare ourselves to how we fare with other regions in the province, we have the fifth highest case rates at the moment. The other case rates are higher in regions, mostly in the north, in the northern regions of the province, such as Northwestern, Sudbury, Porcupine, Thunder Bay. We have seen some other local regional increases, such as in Lambton as well. But overall, our rates are still relatively higher compared to most regions in Ontario. When we look at our percent positivity, we continue to see an increase. We're currently at 16% for the whole of last week, and this has been going up for the last couple of weeks as well. However, when it comes to our hospitalizations, we have seen and continue to see low to declining cases of COVID-19 in our hospitals. This includes both in our inpatient acute setting, as well as in our ICUs as well. Now, this time last week, we did see an increase in our wastewater surveillance. However, for this week, as the week has progressed, we have continued to see a decline. Now, moving on to our deaths, our trends for our deaths have remained similar for the past couple of weeks. We continue to see about 3 to 5 deaths overall. This week and last week, we saw 4 deaths during each week. So one of the asks for this week was to include the vaccination statuses of the deaths of our cases. So we looked at our deaths from the beginning of January up until March 20th, and we calculated the rates of those who've passed away for the vaccine status. For those that are unvaccinated, the rate per 100,000 was 47.3. For those with only 1 dose, it was 31.3, and with 2 doses and 3 doses, they're fairly similar at 10.8 and 10.4. Deaths per 100,000 population. So if you want to compare the relative risk for those who are unvaccinated versus those that have 3 doses, those that are unvaccinated are 4.1 times more likely to die from COVID than those that have 3 doses. When looking at our outbreaks, we have seen a slight increase in our outbreaks from last week. Last week we had about 1 outbreak. This week we have about 4. And overall, though, our outbreaks in our region have been going down steadily over time. Though just in this past week we have seen a slight increase. With regards to our vaccination status, our vaccination status has remained relatively unchanged, with some incremental increases that we've observed. Overall, for those fully vaccinated, we continue to see lower vaccine uptake in our 5 to 11 population, whereas in most of the older and senior adult population, we have seen good uptake there. With regards to these 3rd doses, it follows a similar trend to what we're seeing with our 2nd doses. However, there is room for improvement, once again, with across the board, especially with our younger population. We have seen good coverage rates in our older population, but overall, for those that are eligible for that at 12 plus, our vaccine coverage rate sits at 50.5%. Lastly, when we look at our fully vaccinated coverage rates for any resident living in Windsor-Essex, even those that are not eligible, our overall coverage rate is at 79.4%, whereas in our hotspot areas where we have historically seen higher case rates as well. It's at 73.4%. Areas such as the in the downtown area and in some of the county have lower coverage rates. Overall, we've seen a mix in terms of in terms of our indicators. There's been an increase in our case rates and in our percent positivity, but our ICU admissions and hospitalizations in general have been low or have been declining, whereas we've seen a stable trend in a number of deaths that we've observed in the past few weeks, and that's remained fairly unchanged. We're seeing about 3 to 5 deaths, give or take, in any given week. Thank you so much.
Thank you, Ramsey. We will move over to some opening remarks from Dr. Nessathuri now.
So first, if I could just follow up with Ramsey, and he can correct me if I'm not characterizing this appropriately, but it's important to note that we're still having 3 to 5 deaths a week from COVID-19. And that's more deaths than we would expect in any given week from car crashes. And so the burden of disease is still significant in the Windsor-Essex Health District. Overall, the burden of COVID-19 based on these indices remains unchanged or about the same as it was the previous week. Some of the indicators suggest more disease activity, and some of the indicators suggest decreased disease activity. But I think the overall assessment would be that disease activity has remained about the same. If I could shift to another important topic. Today is a World TB Day, or World Tuberculosis Day. Tuberculosis remains a public health and medical problem worldwide. It's a problem here in Windsor-Essex. About 10 million people worldwide developed TB last year, and about 1.5 million people died. In Windsor-Essex, there have been deaths related to TB. Last year, there were 10 people who were recognized to have clinically symptomatic TB, meaning people that had TB and had symptoms, and those symptomatic people could transmit TB to other people. There were 150 people who were recognized to have TB, but were in the asymptomatic, or we call the latent phase of TB. The Public Health Service works diligently to try to contain TB and screen people as clinically appropriate. And although COVID has taken a lot of our collective energies and priorities in the public health service and medicine, I think it's important to recognize there are other diseases of public health significance, and we should spend our energy and resources recognizing and trying to mitigate that as well. If yesterday and today, and more importantly today, the Public Health Services building will be lighted red. It was lighted red yesterday, and a photograph of that is available. The reason that we lit the building red is it's one approach to increase attention of the community overall to the burden that TB has, not only on Windsor-Essex, but the community overall. Anybody can get TB, but there are some people who are at higher risk for TB. And those are people who travel to endemic areas or travel to parts of the world where TB is even more prevalent. People who newly arrived in Canada, or people who have visited a country overseas that's endemic for TB, they're at risk. People that are immunocompromised, such as people who are living with HIV, they're at risk. People who have been involved with the correctional system, or the people who have been incarcerated, they are also at risk for TB. People who live in very crowded conditions are also potentially at risk for contracting tuberculosis. The other thing I'd like to share is that TB is an immensely treatable disease. It's curable. So recognizing people who have asymptomatic or latent TB is an opportunity to provide them treatment so that they don't get clinically ill from it. And that is really a very important opportunity in public health. And it's a particularly important opportunity given the fact that we've had people die of TB in the Windsor-Essex Health District. So the other thing I want to share today is that, and this was released to the media and to the community, is that we've had our first case of recognized influenza in the health district. When we say recognized, that means that someone has laboratory confirmed influenza. We don't test most people for influenza, so it's likely there are more cases of influenza in the community. It's late in the influenza season for sure, but the influenza season still continues for a few more weeks. There's still a role for influenza vaccination, and I would encourage people to get vaccinated if they are in fact eligible for it. So thank you, and I'm happy, and we are all happy to answer any questions.
Thank you very much. We will move into our first round of questions from our media. We will start with AM 800.
Good morning. I guess this question might be for Ramsey. Ramsey, just looking at the summary for the week, and I noticed that there was no new admissions for ICU this past week. When's the last time we've had that? It seems like there's been ICU admissions basically from day one of the pandemic.
I would have to go take a look and get back. Typically, when we report, we look at people who are currently in the ICU for COVID, so just occupying an ICU bed. But I can go take that and send that via Mike.
Thank you. And then Nicole, I think this one's for you. Just in regards to vaccinations, looks like it went up last week. Obviously, I know the message is still out there, get vaccinated, but with the summaries over the past couple of weeks, it's been decreasing. And then obviously with the increase this week, a positive sign, or how is the health unit taking it?
Yeah, so I wish I knew the exact reason why we saw that marked increase in the number of individuals that are going in for COVID vaccination. Certainly, we're always pleased to see that number go up. Individuals who still haven't received either their first, second, or third dose to take that opportunity. Yeah, your guess maybe is as good as mine as far as what drove that, and perhaps Ramsey may have some thoughts. But I know our team, definitely is happy to see an increase, and some of it may be, our mass vaccination. Sears is the sort of last remaining mass vaccination center, and it will be closing soon. So, it is a very convenient option for individuals. It is walk-in. So, it's still open and still take that opportunity. We like to see that trend continue. Our staff are there and they're available and ready to provide those vaccinations. But yeah, we were happy to see it as well. I'll just mention while we're talking about immunizations, we've also seen a great response to the school immunizations that we're offering out of the Sears Clinic as well. And so we're very happy to see, although it's a small dent in the work that we need to do to catch up, happy to see that is going well also.
Thank you.
Yeah, and if I could just add, Ramsey had shared this data with me, but the current vaccination status in the health district, there are about 432,000 people who live in the health district. Of that population, 76,000 people in total have not received any vaccine. Of that, 56,000 are people over age 5. So about 56,000 people who are eligible for vaccine have not been vaccinated. And we know those unvaccinated people are at 4 times the risk of dying of COVID than people that are vaccinated. The second issue is of the 432,000 people, 191,000 people have had 3 doses of the vaccine. So those 191,000 people have the highest level of protection that we can offer in medicine, which means that there are about 150,000 people who've only had 2 doses of vaccine. I think it's important for us to understand or to accept the construct of up to date with vaccination. Most of the people who received 2 doses of vaccine received their second dose somewhere late last year, probably August, September of 2021. And there is a waning effectiveness of the vaccine. And we would really encourage people who are eligible for the booster injection to get their booster injection. As time progresses from your second injection, the level of protection is likely to diminish. And given that, we want to try to provide the maximal level, we want to try to work to provide the maximum level of protection for members in the community.
Thank you for adding that. Any questions from CTV?
Yes, good morning. And thank you for including the vaccination status of the deaths in the Epi summary this week. Does that ratio of vaccinated versus unvaccinated deaths line up with what you would expect?
Yes, I think that from what we understand, I think province-wide, and the disproportionate number of deaths are among people who have not received the vaccine. And stated another way, the vaccine provides protection against the most severe outcomes, which is death. So when I look at the statistics here in Windsor-Essex, that's consistent with our understanding of the disease at the current time.
Okay, thank you. Do you have any results from St. Patrick's Day enforcement actions or anything like that?
I don't have any specific from St. Pat's Day. We could look at, any complaints that we responded to, et cetera, but I don't have any numbers other than, I think everything went smoothly. I didn't hear otherwise, but we can check what our complaints were at that time.
Okay, thank you. The higher case rates, do you believe they could be due to the loosened public health measures?
We would anticipate that the relaxation of public health measures would lead to greater level of disease activity. It would be analogous to raising the speed limits is likely to have some additional number of car crashes. The challenge in this particular situation is that the testing is not as widely available as it had been previously. And given that, we're cautious about interpreting case count data. The number of people who test positive is probably only a fraction of the total number of people who are actually infected with COVID-19 on any given day. And so as a general construct, I would say that as you relax public health measures, you are likely to have a higher burden of disease. And then when making a policy choice, one has to consider, are we able to accept the higher burden of disease? And do we have the hospital and other healthcare resources to mitigate or manage the new cases that present?
Okay, thank you.
Thank you. Any questions from CBC?
Yes, good morning. It's been a few days now since some of those restrictions have been lifted, specifically masks. Just wondering if the health unit has gotten a lot of calls about that, if people are confused or worried, or how the last few days have been going.
So maybe Nicole, you could comment and I could supplement that.
So I mean, we do look at our call volume. It just feels like the week has flown by, but I think there still is a lot of confusion, especially related to travel and some of the differences between recommendations between travel and recommendations for what's occurring here. Again, without looking at specifically what calls we've received this week, I wouldn't be able to speak accurately, but we're working with all of our partners, sort of managing and monitoring what's happening. And I'm sure Dr. Nasaturi will add, but there's definitely some fear for folks and hesitancy as well as it relates to a masking. And so we'll continue to do our best to provide messaging and support and work with our partners in the community.
I would say these are challenging times for all of us, people rightly and appropriately have a little bit of reflection and perhaps some anxiety about what the guidance is and what level of relaxation they want to participate in. I would say that at this point in the pandemic, it is still an appropriate thing to wear a mask when you cannot remain consistently 2 meters away from somebody. And wearing a mask in crowded settings is probably the best public health advice that we could give people. Just because something is not mandated doesn't mean it's not the right thing to do. And I think we all have our role in trying to manage the pandemic. The Public Health Service is monitoring the effects of these relaxations, and Ramsey and his team and the epidemiology team are reviewing and formulating metrics so that we can continue to report on the burden of disease transmission. And we remain hopeful that disease transmission remains at the current level, but we also recognize that there may be other variants of COVID which may ultimately modulate the burden of disease in the community.
Thank you.
Great. We can move into our round of follow-up questions with one question per outlet. We'll start with AM 800.
Nicole, you mentioned about the mass vaccination center, how it's closing shortly. The release came out earlier this week. I guess staff-wise for the health unit, I know there's a number of different agencies that work there. How many health unit staff members work there that will eventually be going back to, I guess, would it be their previous roles or their previous files that they've been working on?
Well, that's a good question about the exact and accurate number of health unit staff that we have at Sears, which I can't be quoted on because I wouldn't want to give you the wrong number, but we can get that number for you. But, we do have a number of nurses that are there, as well as management staff that are associated with the site. As you know, we're doing both COVID vaccinations as well as school vaccinations. So some will go back to their programming. I think you've heard our hope is to, again, increase our presence and the number of staff that we bring back to our home visiting programs, things that have taken quite a back seat during the pandemic as well. We'll still continue to work on immunizations that need to be caught up. Our teams will be going into the schools to finish and support grade 7 and 8 vaccinations as well, over the course of the summer. So there is still a lot of vaccination work. It just, will continue throughout the community. So most of the staff, again, they'll be redeployed into the community for vaccination, or, some we're working with teams will, start going back to some of the work.
Thank you.
Sorry. Yeah, I think it's also important to note that although there will be a health unit remains available if in the future we have to vaccinate a large number of people in a very short period of time, that we have the operational infrastructure to achieve that goal as well. And although there may be a curtailment of the mass vaccination programs now, we can and should have the ability to ramp up if that's required in the near or intermediate term.
Ramsey, would you like to add anything to that?
Yes, Rob, I just wanted to go back to your earlier question about the last time we saw a case in the ICU for a week. That would be the week of August 2nd, 2021.
Thank you. Appreciate you looking into that.
No problem.
A follow-up question from CTV?
No, thank you.
And a follow-up question from CBC?
I'm all good. Thank you.
All right. Thank you very much, everybody. Have a wonderful day. Our next media briefing will take place on Thursday, March the 31st.
All the best.
Thank you.
All right, bye-bye.
Thank you.